Welcome back to The Line. We just heard from Senator Udall about the important increased and rapid testing will be to successful restarting the economy. The senator was blunt in saying he didn't see a national plan, which means it's up to the states. New Mexico has been aggressive, but does it have the resources and the capacity, meaning labs, to test enough people to open the economy in any meaningful way? Tom Garrity, let me start with you. We all know testing is going to be critical. What are you seeing so far to make that happen?
Well, there are a number of testing sites statewide. I think right now the biggest hurdle to New Mexicans getting tested is the confusion that's being generated by, the expanded testing. Is it open to all? Are there only, open to certain members of a health plan? Is it only open to essential workers? And so there creates confusion. When you have confusion, it prevents that forward progress, which is what we need in order for the economy to really kind of stabilize in the midst of this healthcare crisis. Mm-hmm. I thought that the governor did a good job yesterday, or earlier this week rather, in really kind of starting to address the economic side of this healthcare crisis of this of the COVID virus by establishing, some parameters for the business task force and the council, I think is the proper word, and just some of what those steps will look like to determine the next steps. I think that was very therapeutic for providing some peace of mind for a lot of business owners and a lot of New Mexicans.
Mm-hmm. Sophie, interesting. Tom mentioned Loveless. Just recently, they started doing free tests to anyone, capping it at a certain number per day. But this is a significant change. This is not just folks with showing symptoms or just first responders or medical folks, but anyone could walk in. Is that where we have to go to get the numbers right?
Absolutely. I mean, this is the guidance we're now getting, not just from national experts here in the U.S., but from across the globe, right? Is that the testing needs to be widespread. It needs to also cover people who don't show symptoms, because our conversation is moving now from just treatment and containment, although that is essential at this time, but to the idea that we need to know whether if you've had the disease, what the impacts are of having had that disease. Do you run the risk of being reinfected? Do you now have some form of immunity? That's going to inform the work on vaccines as well. And so that research is really vital as we look forward to, what is our community, what's our country, and what's our world going to look like 6 months down the road, 8 months down the road, et cetera. And without that testing, we're blind. So the fact that New Mexico is on the forefront of that now, we're participating in really important programs involving testing for COVID-19. I think that we should be pretty excited about that, and following what that's going to mean in terms of future plans.
Mm-hmm. Senator, interesting, Walmart has we're starting to do a nationwide rollout of testing in their parking lots, including here in Albuquerque. And they're offering tests to doctors, nurses, police, firefighters, and other first responders, regardless of whether they have COVID-19 symptoms or not. So that's a good program. But let me ask you this. The FDA has approved a at-home kit now, collection to self-test, so to speak, a swab. And I don't know. This is kind of tricky. I think a lot of folks would celebrate that, but a lot of folks at home are not exactly experts at if you live at home, or you know what I mean. It's going to have a lot of false negatives, false positives, but we got to get there somehow on this home testing thing. What's your thought on that?
Well, I think it's a step in the right direction, but like you, I'm not sure that our public is confident enough to even do the testing themselves. Mm-hmm. I like the idea. In Walmart, one other thing they've done is they have allied themselves with a company called Quest Diagnostics, so the results will come back faster.
Right.
I think that's incredible, because to me, the bottom line is we don't have enough data and true information to make decisions. We're doing the best we can, because the thing that surprised me is that you can have had the virus with no symptoms at all.
Right.
And so how do we know? And you can still carry it, or can you still carry it? Can you still, we need to know. And that's where you've got to go to testing everybody. You
Mhm.
can't just do it certainly we should go first with the frontline providers, but we still, to be able to make true and good plans, we have to test everybody. And one of the things that also has happened is New Mexico has joined in a pilot project with the White House to determine how to improve the detection. And this is one of the steps. Increased testing is one of the most important things. And then the second phase of that is to look at where the contact took place.
Right.
So we, if there are patterns or more areas that are prone to the virus. So I think, and I kind of chuckled when I heard that Senator Heinrich said the president virtually had not done anything, when in fact our governor is participating in a program. So
she made mention of that in the presser yesterday.
Yes,
yeah,
and
exactly right. Hey guys, thank you so much